low-fat diets don't work? I think it's time you and I had an honest discussion about low-fat diets. Because if they don't work, then how do you explain results like those of Dr. Dean Ornish?
Every study that we've done has shown that these same lifestyle changes can reverse heart disease. We're able to show that for the first time. Type 2 diabetes, high blood pressure, high cholesterol, obesity. We're doing the first randomized trial now to see if we can actually reverse Alzheimer's disease.
No, not this time.
But I think if you actually look at all of the data, there's more evidence than ever that an optimal diet is low in fat and low in sugar. It's predominantly fruits, vegetables, whole grains, legumes, soy products in their natural forms.
It never happened. It's false. It's an urban legend that never happened.
It's important to note that his studies did not just change people's diet. His intervention also included lifestyle modifications like moving your body more, exercising more, and stress reduction. But the strange thing is that we see an increasing number of physicians coming forward and trying to act like their patients were eating healthy, low-fat, whole foods-based diets and exercising and somehow not getting results at all and ending up with high blood pressure, high cholesterol, obesity, and diabetes. And that just sounds suspect to me. And I'm not the only one who's noticed this. Dr. Pam Popper has also noticed this and spoken about it quite frankly.
They all told the same story. And here's the story. All of my patients were eating a high carbohydrate diet and exercising an hour a day, and they all were still sick. And then I put them on a high-fat, low-carb diet, and they all got well, which is just kind of remarkable to think about it. I wonder where all these great eaters who exercise an hour a day are, because they're not coming into our office. Seriously, look at the data for them. It's just ridiculous.
She's specifically talking about a group of physicians who testified at the 2020 Dietary Guidelines Advisory Committee second meeting. We've been covering this here on the channel. This was a place where industry representatives and doctors and nutrition experts were able to present a case for how they feel we should move forward with the direction of the new dietary guidelines for America. So what I'm going to do right now, guys, is show you some clips of these physicians making the case that their patients were eating low-fat diets and exercising and not getting results. And then we're going to talk about why it might be the case that they weren't seeing results. But I want you to see what these physicians had to say so you can understand this firsthand.
I've been practicing medicine for 30 years. The first 24 were a cycle of seeing patients with their uncontrolled chronic conditions, tweaking medications while watching them gain weight and their diseases worsen. That was in spite of my continually recommending exercise and a diet of whole grains, fruits, vegetables, lean meats, and low-fat dairy. But it never worked, and I mean never. In those 24 years, 2 people lost weight and 1 gained it back. And then, when I got to be middle-aged and that same advice no longer worked for me, I realized that my advice might be wrong. I tried a low-carb ketogenic diet, lost weight effortlessly. Nearly 1,500 people have come through my weight loss clinic over the past 6 years with an average weight loss of 12% at 9 months and have kept it off for at least 18 months. With a reduction in medication burden, improvement in blood pressure, fatty liver disease, sleep apnea, arthritis, and enhancement in quality of life. I was so burned out from doing the same thing over and over and not getting results. I am now excited about practicing medicine again, knowing I can help my patients improve their health.
I've been practicing medicine for 21 years. My family medicine practice consisted of wonderful patients, many of whom had metabolic syndrome and obesity. I managed them the way I was trained, with medicines and instructing them to follow a low-fat diet. Unfortunately, over time, many of these patients became sicker, and I found myself chasing their blood sugars and lipids and blood pressures with more and more medicines. In 2013, I began learning about low-carbohydrate diets as a way of improving metabolic health. I was skeptical at first, but after reviewing the literature, I gradually integrated low-carbohydrate into my practice. My patients started to get healthier. I had such phenomenal success that in 2016, I completely switched the focus of my practice to obesity medicine and metabolic health. In my obesity clinic, I teach my patients how to eat a low carbohydrate, moderate protein, high fat diet.
And then they put them on a low carb diet, and magic happened immediately, and the people were better, and the weight fell off, and the diabetes went away, and it was just a magical thing.
No way. We got you. Not a chance.
This clip from Dr. Jamie Bales is especially telling, and what I want you guys to do is watch his body language when he says that he referred them out to a registered dietitian.
In the first 5 years of my practice, I've followed the American Academy of Pediatrics guidelines and have placed all these children on low-fat diets, encouraging more fruits and vegetables, encouraging whole grains, and more exercise. And one of our pediatric residents did a research project, and he looked at 75 patients that I had placed on these low-fat diets and referred them all to dietitians. And what he found was stunning to me. He found that none of them lost weight, not one. And they all gained weight at the same rate, and some gained weight even faster. Well, this was confusing. I thought I was doing a pretty good job.
It's almost like he said, I told him to eat a low-fat diet, and I sent him to a registered dietitian. You see that little shoulder shrug? It's like, I did what I could do, and it didn't work for them. Well, maybe the advice from the registered dietitian didn't connect up with their actual practices and what they were able to implement at home, because it seems like the dietary guidelines have been recommending a lower fat diet and whole grains and fruits and vegetables, but Americans really aren't eating that way. And as evidence from that, I would cite Dr. Dean Ornish.
But we may have been told to eat less fat, but I went to the U.S. Department of Agriculture database because they keep track of the entire food supply, not what people say they're eating, but what they're actually eating. Mm-hmm. And oftentimes there's a big discrepancy. And what we found is that in every decade since 1950, we may have been told to eat less fat, but we're eating a lot more fat, 67% more fat, more sugar, more meat, and more calories.
More of everything.
And not just Dr. Dean Ornish, but if we look at the data, and I know he cited from 1950 forward, but we can also verify that data from PhD nutrition candidate Kevin Bass. And Kevin Bass has thrown up this link, which shows that since 1970, of the increase in calories that Americans have been eating in that time, something like 55% of those calories have come from fat. And so when we're talking about Americans are eating more calories and where is it coming from, it's coming from added fats in the diet. So that indicates to us that Americans aren't eating a low-fat diet. They aren't following the food pyramid. If we're going to be honest with ourselves about what your patients are doing to not get results, I'm pretty sure they're not eating a healthy, whole foods, plant-based diet that's low in fat and high in whole grains and fruits and vegetables, and exercising more, like you told them, or like you think you told them. Keep watching, because I'm about to show you exactly why just referring patients out to a generalist registered dietitian with the advice that they eat a low-fat diet is pretty much a surefire way to fail on a so-called low-fat diet. But before we get to that, you need to see what these low-carb doctors had to say about carbohydrates at the Dietary Guidelines Advisory Committee.
I have treated thousands of patients who suffer from obesity and obesity-related complications such as diabetes and metabolic syndrome. A carb is a carb is a carb.
My whole life has been a lie.
If you have pre-diabetes or diabetes, you are essentially carbohydrate intolerant, meaning when you put carbs in your body, it becomes affecting your hormones, you become hormonally imbalanced, and you become sick. These are the medical facts. These are the medical facts.
Nah.
Unbelievable.
Yeah. Doesn't it seem like many of them did their best to poison the well on carbohydrates and low-fat diets in general? Their vision for the dietary guidelines involves recommending very low-carb keto diets to the majority of people with metabolic syndrome and prediabetes, which might as well be half of America or more. It's sensational. It grabs your attention. It's like Dean Ornish never existed. But this type of message only serves to confuse the public who need straight talk and information like what we cover on this channel. Now, as promised, why would a generalist registered dietitian lead people down the road to failing on a so-called low-fat diet? Last year, I had a chance to interview a registered dietitian and ask her about whether or not she would recommend both the keto diet or a vegan diet to her clients. What you are about to see was part of that discussion.
It's kind of outside my scope of practice to recommend a diet that's extreme like that, but at the same time, anything that gets people eating more vegetables and less sugar, you know, that's a good thing. But it's just focusing on getting the healthy fats, the lean proteins, and all those good veggies.
As you can see, she viewed both keto and vegan as extreme options, but she acknowledged that whole food versions of either one are beneficial if they include more vegetables and less added sugar. But then she defaulted to the generalist registered dietitian talking points of making sure you get healthy fats and lean proteins. Can you imagine why people who are used to eating a Western dietary pattern might fail when they are instructed to eat low fat, but make sure to get lots of lean protein and healthy fats at the same time? I'm talking about a Western dietary pattern where the main course tends to center around protein choices, with vegetables, and especially starches, acting as a side dish. People will fail because nobody reverses chronic disease by switching to skinless chicken breast, skim milk, and low-fat yogurt. Now, if we take a step back for a moment, let's acknowledge that physicians need access to health professionals who are focused on different nutritional approaches, like the whole foods plant-based diet. Believe it or not, I know practicing clinical physicians who want to get their patients on a whole foods plant-based diet, but it's not enough to tell people, just go watch Forks Over Knives or What the Health, because those films are not instructional on how to eat. Honestly, it's like Dean Ornish doesn't even exist out here. People have never heard of his research, they don't know. People are confused, and they do not know what to do. On top of that, physicians need access to health professionals who specialize in providing guidance and support for plant-based diet interventions with the ability to anticipate common sticking points like satiety and how to go oil-free. If you have any suggestions for how physicians can become a gateway to proper guidance on diet, then let's continue the discussion in the comments section by letting me know your vision. Dean Ornish does exist. Low-fat, whole foods, plant-based diets do work. So how do we help people understand how to change their lives? If you're already doing a plant-based diet and you're looking to take your fitness and results to the next level, then you should look into Florian at Quality Gains. That's right, Quality Gains. He's crushing it here on YouTube, but he's also the type of person I have enough respect for to refer you guys to if you're looking to lock down your training and your meal planning to get the results you want. Get started with a free 7-day trial and use promo code RPV10, like Red Pill Vegan 10, to get 10% off. Hit that subscribe button and make sure to turn the notification bell on. To watch the full video with the registered dietitian talking about keto diets and vegan diets, make sure to click the thumbnail that pops up at the end of this video. Red Pill Vegan, next.